Nurse-driven overdose risk screening and naloxone distribution as part of the emergency department discharge. This project will focus on implementing a nurse-led protocol aimed to improving overdose prevention strategies during the emergency department discharge by increasing naloxone access and providing structured patient education. The opioid crisis continues to represent a major public health concern in the United States. And within recent years, 105,000 drug-related overdose deaths were reported nationwide, mainly of opioids such as fentanyl. Emergency departments frequently treat patients following the opioid overdose events, which place them in a unique position to intervene. However, many patients are discharged without receiving overdose prevention education. The absence of standardized discharge protocols lead to inconsistent patient education and limit access to overdose reversal medication. This creates a significant safety gap and represent a missed opportunity to implement harm reduction strategies. To address this issue, this project is guided by a PICOT question. In patients treated for opioid overdose in the emergency department, how does nurse led overdose prevention education and naloxone distribution at discharge compared with standard discharge care? Affect the patient knowledge and naloxone access. We're going to measure this within the 30 to 90 days after discharge. The purpose of this question is to evaluate whether implementing a structured nursing intervention can improve overdose prevention outcomes compared to the current practices. Current literature strongly supports the effectiveness of overdose education and naloxone distribution as harm reduction strategies. Recent research by Whaley and colleagues demonstrate that community implementing overdose education and naloxone distribution programs experience a reduction in opioid overdose mortality up to 46%. Additionally, studies suggest that emergency department based naloxone programs significantly increase the dispensing compared to standard discharge practices, highlighting the effectiveness of integrating these interventions for routine clinical care. Also, research shows that overdose education improves recognition of overdose symptoms and increase the likelihood of bystanders that will intervene. Approximately 90% of opioid overdose cases are seen by bystanders, so making sure that it's available in the community is important. The proposed intervention for the implementation of a nurse-led overdose prevention protocol during the ER's discharge. The key components of this protocol include a protocol-based overdose risk screening prior to discharge, nurse-led overdose education using the teach back method, distributing of a take-home naloxone kit for patients who are seen as high risk, education on recognizing the symptoms, and naloxone administration. We're also going to electronically record the documentation to ensure consistency in discharge practices. The goal of this intervention is to increase naloxone distribution rates by at least 30% among high risk in the ER patients, improving overdose prevention education and patient preparedness. This project will utilize a quality improvement design with a pre and post implementation approach. With a single emergency department setting, the implementation process will occur during a 6-week period. During week 1 and 2, stakeholders, including emergency department leadership, nursing staff, pharmacy personnel, and IT, will collaborate to prepare for implementations. This phase will ensure naloxone kits are available and the integration of documentation tools with the EMR are ready. During week 3 and 4, nurses will participate in structured education sessions on overdose risk screening, naloxone administration, and patient education strategies such as the teach back. During weeks 5 and 6, the nurse-led protocol will be implemented into routine discharge practices. Compliance audits will be conducted as well as staff meetings to improve. Although the intervention is supported by strong evidence, several barriers may influence implementation. Time constraints with emergency departments may limit the opportunities of the discharge education. Additionally, nurse knowledge and confidence may affect willingness to provide naloxone resource. Research suggests that education and training is significant influence the nurse engagement in overdose prevention efforts. Other barriers may include workflow integration with the electronic medical record system, patient refusal due to stigma or lack of perceived risk, and ensuring adequate naloxone supplies. The expected outcome of this project focused on improving both overdose prevention practices and patient education. The project aims to increase naloxone distribution rates by at least 30% among high risk emergency department patients during the implementation period. Structured overdose education is also expected to improve patient knowledge of overdose recognition and naloxone administration. Additionally, the project aims to reduce repeated opioid related emergency department visits by approximately 10% within 60 days after discharge. Expanding naloxone access has been associated with reduction in opioid overdose mortality in up to 27 to 46%, demonstrating the potential to impact harm reduction strategies. In conclusion, the opioid crisis remains significant and a preventable contributor to morbidity and mortality in the United States. Emergency departments represent a critical point of intervention for individuals at high risk opioid overdose. Implementing a nurse led overdose risk screening education and naloxone distribution protocol has the potential to address gaps in discharge practices and expand access to life saving overdose reversal medication. By integrating standardized harm reduction protocols into emergency department workflow, nurses can play a vital role in improving patient safety, increasing naloxone accessibility, and supporting efforts to reduce opioid related overdose deaths. Thank you.